Hi, I'm Guy DiMartino. I'm a Northwest Indiana estate planning and probate lawyer. And today I'd like to tease out a little bit of the differences between Medicare and Medicaid. But before I get started, if you ever have any questions regarding a Northwest Indiana estate plan or probate matter, you can always reach out to me at indianaestatemeeting.com, and I'll be more than happy to sit down with you or speak to you on the phone or have a video conference, and we can discuss your concerns and your goals. So Medicare. Medicare is a program that is available to folks that are over 65 years old or folks who are on Social Security disability and they've been on Social Security disability for 2 years or longer. And Medicare is health insurance, for lack of a better term. There's many different types of Medicare programs now. You see, we have Medicare A, which pays for hospitalization. We have Medicare Part B, which is pays for physician's visits and ER visits and things along those lines. We have Medicare Part D, which is the prescription drug part. And then we have Medicare Part C, which are Medicare Advantage plans, where private health insurances have gotten into the market and they provide a whole host of services, and they actually step in the shoes of Medicare and will take care of your health care needs under that Advantage plan contract. So Medicare is health insurance. Medicaid, on the other hand, is health insurance, but it is health insurance that is provided based on some type of financial need. So folks who will get Medicaid typically are folks that have a lower socioeconomic or a lower amount of money that is available to them. Folks who are on SSI, which is the Social Security Supplemental Income, which is then again a means-based plan, and folks who might have children or children who are born with certain defects or underlying problems, they may be able to get Medicaid to either supplement their insurance or to be their primary insurance. Medicaid also comes nowadays, depending upon where you are, in many different flavors. There are traditional Medicaid, which is managed and paid for by the state. And then there are managed Medicaid programs where, again, like in Medicare, these programs have come in and are private companies like Blue Cross and Blue Shield, like Humana, like some of the others, and are providing Medicaid type services through the Medicaid program, but they are the insurer and they handle all the paperwork and they pay out the healthcare providers. So if you have a managed Medicaid type program, you might not be able to go to any doctor that you want to. You might have to go to a doctor that accepts that managed Medicaid type of program. So that's the difference between the two M's when it comes to health insurance. Medicare, old age or Social Security disability. Medicaid, means-based, and or if you're on SSI, which is also a means-based test. Now, when it comes to long-term care, Medicare doesn't really pay for long-term care. Medicare will pay for short-term rehabilitative care. A lot of times you might have seen that for folks who actually might have like a hip replacement and they have to go into a rehab facility for 6 weeks or 2 months, or folks who might have had a stroke and they need to go into a rehab facility for a short period of time. But after 100 days, or after a period of time when the person is not making any progress under the rehab, Medicare will no longer apply. And so for long-term care options, folks pretty much only have 2 choices or 3 choices. The first choice is to private pay, to pay for a nursing home or a long-term rehab facility out of your pocket, which could run $7,000, $8,000, $10,000, $12,000 a month, or have a long-term care insurance policy, or qualify for Medicaid. Now, this qualification for Medicaid can be quite tricky because it is a means-based program. So in order to qualify for Medicaid, you have to have a small amount of assets and a small amount of income under a certain amount, which changes pretty much every year. And the exact requirements for Medicaid is not part of this video. This video and the purpose of this was to give you an idea of the difference between Medicare and Medicaid. So if you or a family member see something in the horizon where long-term care will be necessary, and a lot of times we can see this with folks who start to get cognitive decline. See, if somebody has cognitive decline, the ramp or the runway may be 2, 3, 4, 5 years before they need to go into a memory care center. That's when the family should start getting their ducks in a row in order to qualify their loved one for Medicaid assistance if they need to go into a memory care facility. So cognitive decline is one of the things. Chronic neuromuscular diseases that have a long period and a long period between the time that folks are able to get along and folks might eventually need long-term care. And we can see that with some of the muscular dystrophies or some of the types of multiple sclerosis. Now, you have plenty of time with some of these conditions to actually prepare your assets and your finances so when the time comes to go into a nursing home, everything is not lost. So those are some of the issues that you have to think about and understand when it comes to Medicare and Medicaid. If you have any questions regarding a Northwest Indiana estate plan or probate matter, you can always reach out to me. I am Guy DiMartino. Have yourself a great day.